This is the primary speech therapy room in our Miles City office, and I just wanted to show you all these amazing pictures that were done by kids in our community. We had a coloring contest, and these were 18 of the winners. And this is just one more thing that we've done to try to make this a homey environment and to make it something that the whole community can be proud of. But I wanted to tell you a little bit about the services that we offer for speech, because again, if you aren't very familiar with speech therapy, you may just think we work on R's and L's and maybe stuttering. And we do those things, but we do other things too. We work with children and adults. With children, we typically see language delays and speech delays and kind of what we call garden variety speech and language problems. But we do see disfluency or stuttering. We see voice problems. Kids sometimes, especially those that like to yell a lot, and adults too, will end up with little nodules on their vocal cords that can cause voice problems, and there are other underlying causes for voice problems. We work with children and adults with autism, people with developmental delays, drug exposure, in utero, pretty much everything. With adults, we tend to see more of stroke patients, people who have neurological degenerative diseases like Parkinson's, really a large variety of people. In addition to working on speech and language, we also work on feeding and swallowing. And sometimes with adults, as they age, problems can emerge. Strokes and head injuries can cause feeding and swallowing problems. And then of course with young children and babies, there can be things that are present from birth that we need to work on. One of the really unique things that we do, and we are one of very few clinics in all of Montana that offer this service, is that we work on what's called orofacial myofunctional disorders. And that treatment is called orofacial myology. And that encompasses kind of a group of different problems with the muscles and structure of the mouth. That can be things like tongue and lip ties. It can be a tongue thrust, where there's this kind of tongue forward process when people talk and when they swallow. That can include thumb sucking or sucking on other objects as a habit. Orthodontic problems, narrow palates, breathing problems. In fact, tongue ties are strongly associated with sleep apnea. So these are things that we address in therapy and also in conjunction with other providers, dentists, orthodontists, doctors, who in some cases do releases of those tongue and lip ties, and who can help us in that process of loosening up that tight fascia that contributes to those problems. So we do a series of exercises. It's actually a 10-lesson program that we do that gets people ready for a tongue tie release, if that's what's needed. And then we have some follow-up exercises that we do, and we have amazing success with that. We really love this program. The main takeaway from all of this is that we are communication problem solvers. It is really important to us that we look at the whole picture and not just speech and not just hearing, but we look at that integrated picture and make sure that we're covering all of our bases. And we think that because of that, we offer a really superior experience.